Thank you for staying with us. We continue here. The 14th of November is World Diabetes Day, and there's been an increase in demand for diabetes drugs for weight loss. According to a new study by the University of British Columbia, some of the drugs have a high risk of pancreatitis. Joining us now is Dr. Patrick Ngassa Piotie, who's the chairperson for the South African Diabetes Alliance. He's also the co-founder of the University of Pretoria Diabetes Research Center. Dr. Piotie, good to have you on the program this evening. So we are seeing a surge in the use of GLP-1 agonist medications, for instance, Ozempic as well as Wegovy, not just for managing diabetes, but like we've learned now, for weight loss as well. From a medical standpoint, what are your thoughts on this trend? And do you think it's contributing to a misunderstanding, if you will, on the primary purpose of these medications?
Thank you very much. Santa, thank you for having me, and good evening to your viewers at home. Yes, as you rightly said, we know that on the back of the discovery of GLP-1 receptor agonists, the semaglutides such as Ozempic and others that you've mentioned, there's been, initially those drugs were developed for glucose control for diabetes, but it has been found also that they have great values in terms of weight management. And the consequences of it, considering the fact that everywhere on the planet, globally, there is overweight and obesity. That is a very big challenge. People have now turned to those drugs to do weight management. So yes, we have seen the reports, and as you rightly said, some research have found that there is effect. As you know, all drugs come with secondary effects, some common, some less common. You mentioned, for example, pancreatitis, there's also kidney issues that can be reported. But the big picture is that also we are unaware of the long-term effects. So as it is a new drugs, there's still some research that are ongoing, and it's only some years down the line that we'll find what are the effects of those drugs on the human body. Nonetheless, we agree that they are values and they need to be used with care, as all drugs. They need to be prescribed. The persons using it should be monitored and followed by a doctor, and so that to ensure a safe use as possible. And then, yeah, we would like to say that they're important. They play a role in the management of people with diabetes, and they make a big difference in the lives of millions of people all over the world.
Dr. Piotie, I want us to expand a bit more on the effects of these drugs. As you've mentioned, there's a growing concern about the side effects of these drugs, particularly gastro issues like pancreatitis, intestinal obstruction, but also gastroparesis for people without diabetes, for instance. How significant are these risks? And should people without diabetes be more cautious when considering these drugs for weight loss?
Yes, as I said, there should be caution in using all kinds of drugs. They should be going by the indication. They should be prescribed by competent healthcare providers, and they should be the required monitoring. Yes, unfortunately, in the age of social media, there's been a lot of conspiracy theories. There's been a lot of fears around the drugs. But as we see in common practice from my colleagues, these are drugs that are helping patients. These are drugs that should remain indicated for people living with diabetes, and to a certain extent for people who would like also to use them for weight management. Is all the message actually that we should put out is that they should be used safely. As I said, they should be prescribed by competent healthcare providers, and there should be a monitoring. Yes, the secondary effects are there. Some, as I said, are common, others less. And there are very many people who are using them safely and have seen great results.
So while studies show that, for instance, weight loss benefits, there are also other concerns about the long-term effects of using GLP-1 agonists for non-medicinal purposes, for instance. As we learn more about these drugs as well, what do we know about the long-term safety of the drugs for people who aren't diabetic, for instance?
Yes, we are still learning about the long-term effects. They have been in the market not long ago, at least compared to other drugs. So as I said, the research is still ongoing. I think despite the buzz around those drugs, I think shouldn't lose sight of the real problem here. The real problem here is that we are sitting with a crisis, diabetes, which is a public health crisis in South Africa and elsewhere. We are sitting with high levels of obesity and overweight. We are sitting with a society and communities that unfortunately found themselves in circumstances that where they struggle to adopt healthy lifestyle. I think that should be our focus. That's where the powers that be, including you, me, and the communities, should put our effort. Diabetes is there to stay, and we need to do everything we can to address it. Yes, it comes on the back of high levels of obesity and overweight, and the success of those drugs. As you know, the companies manufacturing them are making a lot of money these days. Nonetheless, we prefer to focus on diabetes. There are other ways of addressing the weight loss. It's just that for us to ensure that communities can adopt those healthy lifestyle and not have to resort to drugs like the Ozempic and others, they will have to, unfortunately, eat well, exercise, and we need to make sure that those are accessible. Healthy food should be accessible. The community should have access to enough information to make the right choices when it comes to adopting healthy diets. And there should be circumstances or conditions gathered so that people can exercise safely in their communities when they don't have access to gym memberships and others.
Dr. Piotie, for individuals with diabetes, these medications may offer, some would argue, significant benefits in really controlling blood sugar and also managing associated risk. How do the benefits of GLP-1 medications for diabetes patients compare to the risks of their use for people without diabetes? Or maybe to ask it another way, is the risk-benefit balance different in these two groups?
No, definitely. For a person living with diabetes, there is not only the glucose regulation of blood glucose levels, but there is also the reduction of appetite. So therefore, we've seen good results in people living with diabetes. I'm not sure that there should be a comparison because whether a person is not diagnosed with diabetes, they could be in the condition called prediabetes, whereby because of their weight and because of other factors, they are already showing early signs of diabetes. So when you look at the physiology, there might not be much differences from somebody who is diagnosed diabetes and somebody who doesn't have the disease yet or doesn't display all the symptoms of the disease. It's just that in the one case, you might have already the compensation in terms of high levels of sugar in the blood. In the other, the person might just be at early stages. So physiologically speaking, there might not be big differences. Therefore, the effect or the way the drugs will work in those bodies might not be different. We know it helps regulating blood sugars. That's why sometimes even people who are in prediabetes might wish to have access to those drugs so that they can avoid their condition to progress to full-blown diabetes. Nonetheless, as I said previously, it is important that the indication should be made by competent healthcare providers, and the patient, whether already diagnosed with diabetes or not, should follow proper monitoring to avoid those complications or secondary effects from the usage of the drugs.
But as the popularity of these medications increases, do you believe there's an ethical responsibility, especially on the part of pharmaceutical companies, healthcare providers as well, and even influencers, to really educate the public on the potential dangers of using some of these drugs for weight loss, especially when they come with serious side effects here?
Yes, I think the first responsibility for education comes from our governments, from the country. You will imagine pharmaceutical company, they haven't shown to be sometimes ethical. We saw the opioid crisis in the US, and the influencers obviously will depend on who is paying for their post. So in actual fact, it's for us public health specialists, it's for the media, for example, because of the access to the people, it's for the government to take a strong position, as well as the professional societies. And I think it has been the case. When those drugs have been approved in the country, I'm sure they've gone through all the regulatory processes to be in the country. But as always, there could be abuse of a drug. So that's what we want to avoid. We want the public to be cautious. We want the healthcare providers to do their job as ethically as possible, as you mentioned. And unfortunately, where necessary, the pharmaceutical companies and others should be brought back to order where there are deviations that have been observed. But so far, again, as I mentioned, our message is really for us to look at what can be done for the diabetes crisis that we are going through in the country, and what measures we can adopt to improve the situation. We do believe, for example, that the drugs that we are talking about play a critical role in the public sector in South Africa at the moment. They are not widely available. They are still very expensive. However, we believe that in certain circumstances, they should be introduced so that people in the public sector can also benefit from the great advancements that those drugs represent.
Dr. Piotie, as we wind down our conversation, but to also take from a comment you made about doctors doing their work, how can healthcare professionals then better communicate the potential risk of using these diabetes medications for weight loss to the general public, especially in light of the significant media attention and also this growing public demand for these treatments?
Yeah, it's all start with education. Not only as healthcare providers, we need to inform ourselves. We need to be on par with the new developments. We need to know, and I'm sure that's what the colleagues have been doing. What are the indications? When is it not indicated? And what is the appropriate use of those drugs? And therefore, whether using platforms like as the media or channels as yours, or I know some of the healthcare providers are quite active on the social media. It's also good to reach out to the population and try as much as we can to vehiculate the right message. Unfortunately, we know that bad news sometimes travels faster than good news. So we know that the conspiracy theory will always be there, the viral videos will always be there. But in one-on-one or otherwise interaction with patients or interested individuals who would like to know more, we need to make the information accessible. And that should be the responsibility of healthcare worker, or as well as the government, as I mentioned, Department of Health and other professional bodies.
Dr. Piotie, while I do appreciate that you're not speaking to us as a dietitian, for instance, for individuals who are struggling with weight management, what would you recommend as safer long-term alternatives to medications like GLP agonists? How can individuals work their healthcare providers to really find sustainable and healthy approaches to weight loss? Earlier on, you spoke about adopting a healthy diet, even issues around exercising as well.
Yes, thank you for the question, and you rightly prefaced it by saying that I'm not a specialist dietitian, but the science around obesity and overweight have evolved a lot. We understand more, and it happens to be where there are genetic factors, there are environmental factors. It's really a complex issue that should probably be addressed on the one-on-one based on the specific case that would be the healthcare worker will be dealing with. Nonetheless, as public health experts, we can make broad guidelines and we can make broad recommendations that will ensure that the majority of the population should abide by those guidelines. What I mean is that principles as healthy diet or exercising are those that are widely announced by the WHO or even the Department of Health. We know that we need to look after ourselves. We need to pay attention to what we eat. We need to pay attention in terms of exercising. Nonetheless, we need to understand that when it comes to making that decision of what we eat or the ability to exercise is not, unfortunately, accessible to all. So our responsibilities as healthcare workers, especially Department of Health, and actually the government and the whole of society, is to increase the likelihood for people to eat well. If the not so good options are the ones widely available, it will be difficult for people to have access to eat well as we want. For example, if you are living in the township, You have to travel 3 hours to go to work in the morning and 3 hours to come back. By the time you're at home, it's late. How likely are you to go out to run for a job, which will be the cheapest option? With the safety and the crime that you are faced with, it will be difficult. So it's, yes, the message on the one-on-one basis is eat well, exercise well, but as a society, we need to ask ourselves, are we doing enough to ensure that the majority are eating well? Are we doing enough to ensure that people are able to exercise with the limited means that they have?